Hi everyone, welcome to the second webinar in this series of the Gut Transformation Programme. Today's webinar will be presented by Sarah Sharp. My name is Laura and I will be here for the duration of the webinar. If you would like to ask a question, please click on the plus sign next to questions. Type your question in the box and click on send. Questions will only be answered at the end of the webinar. If you would like to print out the PDF of the presentation, click on the plus sign next to handouts. You can then click on the PDF to open it and print it out. You can hide the control panel by clicking on the white arrow with a red background at the top right-hand side of the screen. To view the control panel, just click on the arrow again. I will now pass you over to Sarah.
Thanks, Laura. And as Laura mentioned, welcome to the second webinar in our programme. And today is very exciting as it's day one of the programme for those of you who are starting and joining in with us. So today we'll be going through the regime and the supplements and really looking at how supplements fit into the gut transformation programme. If you want to share any of your experiences online, then don't forget to check out the Facebook group. This is where we get a lot of food questions at this stage. So as people are actually starting to live the programme, so we're ready for any questions that you have, and we can answer them on there, as well as if you call the office. So just looking at the learning points, we're really looking at the 5R programme. We're looking at the supplement regime, so what are you taking and why. We'll go into some of the research on the ingredients as well. So in using these supplements, why are we really adding these in as a standard? And then also we'll be looking at how to personalise this programme for any individuals with extra needs, so using this accordion concept as well. So you've all received this pack and you've got these supplements. So we've got the Candex SIBO, the Similase, Ultra Probioplex Plus, Glucogenics and Nutrimonium. We'll take you through the next hour. We'll be looking at all of these, but also any other products that you might use to individualise this process. So looking at the 5Rs, we've got such a useful programme in the 5Rs, such a really good framework for trying to support people with gut programs. So having this program in this format is fantastic to be able to to just put that into practice really. So with the program, we have this basic framework, but we also have something that can be individualized. So we have this differential diagnosis. It's a systemized protocol that we can use to help with differential diagnosis. So often when we've got lots of people with similar symptoms, we know that with IBS it's much more complex than that, and every client can be different and their causes can be different. And this is one of the reasons why GPs and the traditional medical system can often fail people with IBS type symptoms, and that's why they come to search for a nutritional therapist or a practitioner, healthcare practitioner. So within the 5R program, we're looking at what does this patient have that needs to be removed. So we're looking at any pathogenic growths in the intestinal tract, looking at allergens in the diet, for example, to try and enable healthy GI function. We're looking at what does this patient need to have replaced. So is it stomach acid, digestive enzymes? So this is why we're doing the burn tests as well with this part of this test, to look at ways that we can improve GI function. As simple as this as well, it could be something just like chewing their food, replace the environment in which they're eating. So as well as looking within the framework of this program, we can look at the wider picture as well. What does this patient need to support and or re-establish their healthy balance of microflora? So looking at their history, what's happened with their microbiome, what can we do to try and help? Do they just simply need to add in a bigger diversity of vegetables and fruit, in order to be able to support the microbiome, or is it something stronger that they need? What does this patient need to support the healing of the mucosal layer? So that's another consideration. And then also, what does this client need to retain? So we're adding in a fifth R into this program to what do they need to retain their lifestyle moving forward? Do they need to exercise? Do they need to look at their sleep hygiene and their stress management? Do they need a permanent nutritional support going forwards, or a permanent a maintenance program? And this really brings us to the point that this genetic differences means that it's more important to know the patient who has the disease and the disease the patient has. So every individual will express the characteristics of something like IBS very differently. And this means that we treat them differently. So that said, now digging down into the first phase of the 5R, which is remove. So we're looking to remove any pathogenic bacteria. It may be viruses, fungus, parasites. It could be toxins caused by these things, so things like lipopolysaccharides that are very toxic. And then also looking at dietary modifications. So are there foods that need to be removed? Anything that the patient is either intolerant to or showing symptoms to that might be exacerbating GI dysfunction. What this can also do is produce this kind of pro-inflammatory state as well. So it's possible that it might just be for a short period. It may just be that it's the 6 weeks that they're doing something like the gut transformation program, that they're actually then going to be having some dietary restrictions, and then we can start to test their response as we reintroduce foods at the end. It can be that simple. For some people, it may be something that you want to investigate further at the end of this program once the reintroduction has demonstrated some strong reactions. So as mentioned last week, we were looking at not every symptom of gastrointestinal upset or dysfunction will be displayed within the gastrointestinal system. So whereas people make a strong association that they need to do something about their diet and their guts, when they are looking at gastrointestinal support, we also have all these other things as well. So we know that things like chronic bedwetting can be linked with gluten intolerance and leaky gut. You know, really food allergy is one of the causes, and we can start to see that people don't always associate the foods that they're eating with the symptoms that they're expressing. So this is just another list to look to see if a gut transformation program may be helping with some of the symptoms. So with removal as well, we're looking at just taking a moment to pause and think. I think a lot of the medical profession will look at things like diarrhea or strong cases of diarrhea and test for maybe one or two different intestinal upsets, but in the belief that parasitic infections are very, very rare. They're only experienced by people in poor countries with poor sanitation, and they don't think that it's important for the everyday Joe Blogs on the streets. But reality is very different. So we're still exposed to a lot of these kinds of parasites that, depending on where our microbiome is and what's happening in our gut, can cause a whole host of symptoms. So it may be that they're not particularly the nastiest parasites in the world, but in the situation, in the environment that they're in the status of that particular gut, we see that we're getting symptoms. So it may be that we still want to use a program like this to try and eradicate. With the first 2 weeks that you're now embarking on, we have just 2 supplements out of the 5 to concentrate on. So what we have here is we have the relatively new Candex SIBO, and we're looking at taking this one 3 times a day, and also Similase 3 times a day. So we're looking to try and support and aid digestion and just sort of create a bit of sort of light relief for the guts as food's going through the system, so it's not any larger molecules of food or particles of food are not feeding bacteria in the wrong places further down the system. And then also the Candex SIBO to try and help remove Now, when we're looking at this program, we've opted to try and keep it manageable. So trying to keep this program as accessible as possible. So herbs are often taken away from food, but we have opted here just to pop them in with the meals, so it's easy for people to take. So it's sort of, this is where your management and coaching would take over with a client to look at when they're best going to be able to take the formulas. So if taking one at lunchtime is just not appropriate for them, then maybe we can find another time of day for them to take it. So that's something to discuss with the clients as best as possible. The best time to take it is really when they're going to remember to take it and they're going to get the best use out of it. And similarly, obviously, with a meal is the best time to take it. So looking just now at the Candex SIBO, look at the formula in a bit more detail. This is a very welcome addition to our range. It's the first time we've had something that's really combining all of the known really great herbs for dysbiosis in one formula. So we've got the oregano, the garlic extract, and the berberine all together with grapefruit seed extract and the caprylic acid as well, in the form of calcium caprylate. So this is a really nice formula that's combining everything together. We get a really good symbiotic support from this as well. So the feedback that we've been having is amazing in terms of particularly bacterial and fungal infections. So I've put some research in here just to go through in a bit more detail. Oregano, it's been long been used as a digestive support. It's really great for lots of different gastrointestinal disorders. It's choloretic, it supports digestion, it's antispasmodic, it's got an oral antiseptic as well. It can help with UTIs. And it's just so good in so many different situations. As well as this, we have some really good evidence and support for its antifungal support, and also its antimicrobial support, so antibacterial particularly. It's been tested on lots of different microorganisms and is a really good strong one. Then the caprylic acid, we're looking at this one. Again, we've got really good evidence to suggest that it's antifungal and antibacterial. So we get some really useful agents in this Candex SIBO. Just more research here as well from looking at the antifungal effects of the medium chain fatty acids found in virgin coconut oil. So it's, again, looking at things like C. difficile, so it can actually help to inhibit the growth of C. difficile. So this is a sort of thing that you can take for an active infection, but you could also take it, say you were traveling abroad, or for somebody vulnerable staying in hospital, you might just want to take it at a lower dose as a daily dose, just to try and boost and help to keep away some of those nasty parasites. With berberine, there's some absolutely fantastic research on berberine at the moment, both for inside and outside the gut, on some of its strong effects. Berberine is actually, in some countries, it's an over-the-counter medicine for diarrhea, so it's got great anti-diarrheal research as well. So particularly where you've got clients with diarrhea, this could be good. It's been found that if it's due to Klebsiella, Giardia, Salmonella, Shigella, E. coli, cholera, it's really quite effective. So we've got some fab research for putting the berberine in there. Also looking at a few other ones, it's great for bacterial infections as well. It's working on Staphylococcus aureus, and just looking, there's some more research here, looking again at the different bacterial agents and the different parasites that it can be very supportive for as well. What was interesting in this research was that it's not only has a role as an antibacterial agent, but it's thought that this is maybe due to the inhibitory effect on the endotoxic, the lipopolysaccharide activities of the bacteria. So it can actually help to reduce the amount of the LPS that's produced. And as we know, this LPS is something that causes a lot of disease and dysfunction, causes a lot of inflammation, and it's particularly toxic as well. So berberine is a really fantastic herb to use. So garlic, we have garlic in there. Now it is as an extract, so for anyone following the FODMAP plan, then it doesn't have those fructans in there, so it's perfectly safe to take for anyone following the FODMAP program. And the garlic is traditionally used to treat bacterial, viral and protozoal diseases. So again, it's really covering a wide range of different dysbiosis situations. And then more recently, we have research again to show that it's effective against a whole different plethora of gram-positive, gram-negative, and acid-fast bacteria. So there's a huge host of them there that it's supporting as well. And the citrus seed extract, again, there's some really classic research around the citrus seed extract when it comes to bacteria and yeasts. So we're seeing it's again a really useful agent. Patients reporting improvements in symptoms after using citrus seed extract to remove these agents. In some situations, then you may still have a client, if we're digging deeper, if you're doing testing with them, you might have a client that does need to go for some medicines, go to talk to the doctor about what's shown up in their test results. So there's just some information here to sort of help you with that. If they're going to take medicine, antiparasitics, then at least here's some instruction on what dosage it might be best, and at least we'll know then that they are on them, and we can start to support them around that, around taking those antibiotics and those antiparasitic agents. So this is really if we identified something in a client, so say they've come to you and they already had a history of trying to solve their IBS symptoms, then it may be that this is an area that you would extend that accordion. So if you've done testing or you suspect testing, or say once you've gone through a basic program with somebody that you would expect to have improved their symptoms and it hasn't, then testing may be warranted in that situation if you don't test automatically. But something like Blastocystis hominis might be identified at this stage, for which we would recommend berberine and grapefruit seed formula. And also, if you're doing testing, it may be that you've identified SIBO, so it may be that this is somewhere that you'd want to stay longer. So if you were going to introduce the berberine and grapefruit seed at this stage, we'd still recommend following the 3-month protocol for blastocystis. Or for SIBO, you might want to stay here until you've been able to retest and see that the hydrogen and methane levels have dropped. So just moving on from the remove phase, we're now looking at the replace. So before day 1, we recommend that you've done the acid test to see whether you need to again extend that accordion maybe, and I'll talk more about that in a moment. But essentially we're looking at replacing those digestive factors, helping to just take some of the pressure off the gut as we go through this program. So even where somebody comes back and they don't need the hydrochloric acid, then just a gentle support can be just a fantastic addition to this type of program. So the one we're using is a really nice broad spectrum gentle enzyme formula. So it's from plant enzymes, and we've got in here the protease, the amylase, the cellulase. So as well as being good for fats and proteins, it's got the lipase in there as well. It's really good for a whole host of starches and plant materials. This can be particularly useful if somebody's suddenly upping their vegetable and fruit intakes. Maybe they're not quite used to that high level of fibre. That can be really helpful. But also, again, with anyone following FODMAP or anyone who suspects that there might be some intolerances, we've got lactase in there to help with lactose, which is one of the FODMAP areas. And then we've also got things like the sucrase and the maltase, so looking at some of the disaccharides as well, and just helping with absorption of some of those longer chain starches. We find that just one a day is fantastic. For anyone outside the program who's consuming like large amounts of red meat and struggles with that, then you can go up to 2 or 3. We found that this is a really well tolerated formula, even by people who are quite sensitive, which, let's face it, with a gut program, that's quite a lot of the individuals that will be going through this program. So it's got the broad range of digestive enzymes to help across the board with the foods that are coming in, and it's reliably effective across a wide range of pH conditions. So all the way from pH 1 to pH 12, you can still get activity of the enzymes. Some of the animal-derived pancreatic enzymes you can struggle with a little bit in some pH conditions and varying pH conditions. So they rely on that trigger of the stomach acid, which is why ours tend to have that stomach acid combined with them. Really what we're looking to do is aid the breakdown of any potential triggers of food sensitivity before they reach the bloodstream, and also to help with absorption of nutrients. So it's got the phytates in there that help to digest. It's got the phytase enzymes that help with the digesting phytates that can sometimes bind minerals and nutrients, preventing their absorption. And then, like I say, we're just looking to make sure that the food is fully digested, to make it a lot easier on the digestive system and not feed any of those bad bacteria or that dysbiosis. So we've been using this formula for a really long time now, and we've found that it can just be a really great formula to add in. We've got the lipase in there, which is critical for fat digestion and can help with problems of fat malabsorption or steatorrhea. So anyone suffering with any conditions that cause problems there, like with gall and bile problems, and also people suffering from undiagnosed lactose intolerance, this supplementation might be particularly appropriate because it's got the lactase in there. We also have a quite fun 2-minute challenge that you can point out to your clients as well. We have this leaflet online, and we can post it into the Facebook group as well. So the 2-minute challenge is just for people to be able to comprehend and see the results of something like Similase, where you simply just make a really thick, gloopy bowl of porridge where the spoon's stood up in the middle, and then just break 2 capsules of Similase and stir the contents, and just in a few seconds you'll start to see that the porridge is transformed into quite a light watery liquid. So it's really helping with the fibres and helping to digest it, and that's a really good visual for people being able to see what's going to help happen in their guts, particularly if they're resistant to some of the changes in the diet. So really that's to summarise week 1 and 2. We've overlapped the remove and the replace, and then now for moving forwards after that, when you get to week 3, we'll be looking at focusing on reinoculation and repair. So with reinoculation, we're looking to get a really healthy microbiome. We have way more genes in our microbiome than we do in our human genes, and this means that the microbiome can help us to express different characteristics and help us to move towards health or disease. So we're just looking to turn that around for anybody who's having GI symptoms or any of the symptoms that we've been talking about. It's the weeks 3 to 4 will be a little bit more heavy on the supplements. The diet, people should be getting used to the diet by week 3. Hopefully that would be helping some of their symptoms to be relieved. Maybe they're experiencing less inflammation as well. So they should be starting to get used to this. We're going to continue to relieve the pressure on the gut with the Similase, and we're going to continue to remove. So we'll have a full month of the removal phase with the Candex SIBO. We just find that a month is a really fantastic time frame to give a good support for any kind of bacterial or fungal infections in particular. You can extend if you know that there's a stubborn infection or you know that they're particularly prone, you can extend that to 6 weeks for bacteria and yeasts, but we do get really good results with this program with just 4 weeks. So for reinoculation, our microbiota is so important and it's affected by whatever has happened to us. So here, for anyone who's not using the functional medicine timeline, then I do recommend it because it goes right the way back and we can start to analyse what's happened to people over the course of their life, and you can really help to identify whether this is somebody who maybe needs to spend more time in reinoculation, in the reinoculation phase. So is this their phase that needs to be extended? So repeated exposure to things like broad-spectrum antibiotics in the first 2 years of life can be associated with early childhood obesity, more common childhood infections with the most frequent diagnosis co-occurring with broad-spectrum antibiotic prescription. So narrowing antibiotic selection is a potentially modifiable risk factor in childhood obesity. So looking at why people are getting the infections or why people were getting the infections, and then seeing what the consequences of those were. Just a note as well on something like SIBO, or people who are struggling to introduce probiotics or that kind of thing, then again, this is a phase that you might want to spend a little bit more time on how we introduce those. You might want to wait until the clearance phase is done, spend a bit more time in the remove phase before then reintroducing. It won't be that they can never reintroduce these foods, it's just a matter of timing, so it's just about extending that first phase. So the strains that we use with the Ultra Probioplex Plus, this is a relatively new formula for us. It's an extension of our Ultra Probioplex range, and it's one that we were all really excited about because it has a really nice number of the bacteria. So we've got 25 billion live organisms per capsule of the most researched strains that exist. So it's the Lactobacillus acidophilus NCFM strain and the Bifidobacterium lactis BIO7 strain. There's a small amount of blackberry fruit in there as well, which can help with bowel transit and bowel comfort. So we're seeing relief in some of the symptoms of IBS, and also it's got a small amount of the vitamin D in there as well. And we have lots of great research on this. The bit that I got really excited about was that it's shelf stable, which means it doesn't have to be kept in the fridge. Now, this doesn't sound like a huge thing for a probiotic, but it just means that coming back to that sort of management and coaching of your clients, it means you can put it somewhere that's really accessible to them. If they're not used to taking supplements, or they don't often remember to take their supplements, then you can put it where they're most likely to remember when they're going to take it. So my husband is classic for this. Somehow the fridge seems to just be an alien environment for him to go into to get his supplements. But if I can leave them on his bedside table, for example, then he's much more likely to take them just before bed. So the reason that we're using these strains is because we have such great support for them. So we've got all the support and research to show that they resist digestive secretions and survive through the gastric transit. We know that they adhere to human intestinal cells, and that they are responsible for inhibition of pathogenic growth as well. So they're crowding out those bad bacteria. So they beneficially influence bacterial balance. So we're restoring that microbiome, and we know that we are by using these strains. We support healthy digestive function, so they're helping us to digest our foods as well. We get reduction in things like digestive pain. We promote balance of the immune system. We reduce gut inflammation. It improves bowel regularity. Bifidobacterium in particular has been shown to reduce the incidence of intestinal candida. We've seen improved immunity in children. There's a couple here as well that I really like the improved lactose digestion. So these bacteria actually feed on, particularly the lactobacillus feeds on lactose, so that's helping with digestion there. And we also get the reduction in the cancer-associated intestinal enzymes. So where there is a big dysbiosis, something like Lactobacillus acidophilus can actually help with reducing the presence of the beta-glucuronidase, as well as then reduce levels of toxic amines that then present to into the blood. It can improve small intestinal bowel overgrowth, which I know a lot of people get nervous taking, particularly lactobacillus in SIBO, but we have got some research to show that. I would tread carefully and monitor symptoms anytime that you're introducing this. And again, it depends on what stage we're at. So if you're doing testing with them, the breath testing, then it would be something that we'd be looking to sort of stage the introduction. Jo will go into testing a little bit more in some of the upcoming webinars, Jo Gamble, and she'll go into that in more detail. And so it's also been shown to inhibit urogenital pathogens and again improve immunity in children. So it's a really fantastic strain. It's also been shown to increase antibody and cell-mediated responses. So it's improving our immune response to Candida in an experimental model. And we also have the addition of the Bifidobacterium lactis, which has been also found to increase expression of our immune system. So it's the interleukin-10 and the IFN cytokines are really looking at being regulators of the Th1, Th2 pathways. So these often get out of kilter, so we see them in bacterial infections, but also in allergies. This sort of seesaw between the two can vary quite a lot. And what we're doing with something like the Bifidobacterium is supporting the gut, and a healthy gut microbiome is basically what helps to balance them. So the T regulatory cells that are part of the Th3 immune responses actually helps to balance out the Th1, Th2, and we see this improving an awful lot of symptoms around immune modulation. So just here's some of that research about SIBO. We mentioned SIBO briefly. Looking at the research we've got, and we have more of this in our research summary paper on probiotics. The Lactobacillus NCFM strain has been found to reduce blood levels of toxic metabolites in patients with SIBO, suggesting that the Lactobacillus acidophilus is inhibiting the populations or the activities of the dimethylamine and the nitrosodimethylamine producing bacteria, and thus can improve SIBO. What you might want to introduce in the program is some prebiotic rich foods as well. So a diversity of different vegetables is going to feed our microbiome with the prebiotic support. So this is going to be where we eat our rainbow, or I know that Dr. Chatterjee recently has suggested that we eat eat the alphabet to try and encourage this diversity over the course of a month. And the only thing I would suggest here is that you watch out if you're following a FODMAP plan for things like the onions and the garlics and any high FODMAP foods. But it is quite individual for for some. So just have a look at those. But yes, so get that diversity in and feed that microbiome. So now looking at the repair phase. So when we're looking at repair, we are really looking at that leaky gut and trying to resolve it. So we find that leaky gut can be caused by genetic factors in the immune system, SIBO, protozoal infections, alcoholism, strenuous exercise, so any for athletes or anyone who's over-exercising, as we age, looking at nutrient depletions, and also looking at chemotherapy and things like that can be a factor afterwards. It's associated with things like, we've talked about the allergies, pancreatitis, so we're looking at maybe a deficiency of enzymes, headaches, autoimmune inflammatory diseases, atherosclerosis, type 1 diabetes, rheumatoid arthritis, IBD, Hashimoto's, psoriasis. Again, really looking at think inflammation. Anytime there's going to be this inflammation, we want to look back at what's happening in the gut, and that's the same for atopic disorders and also obesity. So what we're using for supporting this stage, so at week 3 and 4, we're going to introduce glutagenics, which is a really nice glutamine support with zinc, quercetin, and something called sustamine, which I'll come and talk about in a moment. It looks really simple, but it is so effective and so powerful. So this is a formula that we've had for a good while now. We know that glutamine is the preferred energy source in the upper intestinal tract, really great for mucosal growth, helps to restore any damage that's been occurred in the barrier integrity, and we use it a lot for gut support. So sustamine is a dipeptide consisting of 2 amino acids. It's the L-alanine and L-glutamine that are connected by the peptide bond. It's very stable to heat and acids. It survives the stomach environment, and it's very soluble as well, so it's very well absorbed in the body. Now, the reason that the dipeptide is so important is that there are a series of transporters that allow dipeptides to be absorbed, and amino acids waiting for transport into the cell. Sometimes there can be a bit of a queue and they're not really getting through, but the dipeptide coupling can drastically reduce the time that they're having to wait and reduce that competition. So they get through and we get that energy needed for the cellular recovery, and we get the benefit of the glutamine much quicker. So with zinc, we know that zinc is great for immune support and also for helping to regenerate the gut lining. And zinc deficiency has been shown to induce damage in the gastrointestinal tract. So restoration has also been shown of zinc status has then been shown to improve the GI function. So we know that it's some really good research on including zinc in the formula. So zinc deficiency can arise from several different sources. This was a great diagram, I thought, for guts, but also for zinc deficiency. So we're looking at dietary intakes we know aren't what they could be, PPI medications. So again, with something like a GI program, one of the targets will be people who are often reaching for antacids or who are on PPIs. So look out for zinc deficiency there. Also, high dietary phytates can block that zinc deficiency. This causes compromised GI epithelial barrier function, and then we're open to all of these consequences of a leaky gut. Also in glutagenics, we have quercetin. This is a plant flavonoid, and it is exceptionally good for leaky guts and for healing the guts, as well as things like it's a strong anti-inflammatory as well. Can help with leaky gut by sealing the tight junctions. So it has a direct active role in actually helping with leaky guts. It can also help to stabilize histamine response, which can aggravate a leaky gut as well. So really, really important if there's going to be inflammatory foods there as well. So we do a lot of healing with the glutagenics. So that's really the weeks 3 to 4 is quite an intensive phase. And then the weeks 5 and 6, this is where we start to look at retain. So we're starting to move forward with the retain. And apologies there, that ultra-inflamex should read Nutrimonium. And so at this stage we have, we've still got our 2 capsules a day of the Ultra Pro Bioplex and the glutagenics, and then we've got Nutrimonium. And so Nutrimonium, for those who haven't used it before, is a powdered formula that we make into a drink, and it is really, really nutrient rich. So we have some glutamine in there and some zinc and some probiotics. that are all supporting specifically the gastrointestinal health. We've got some anti-inflammatory and oxidative stress support in there with things like curcumin, green tea, lipoic acid, vitamin E and selenium. We're also looking over time when people have had such problems with their guts. We really get a deficiency of micronutrients, so the absorption of nutrients has been affected so chronically. So this just slowly every day they're just not absorbing. So we're looking to try and restore some of those nutrients in. So we have them in significant levels in there, and then also it's been clinically tested. So just we have the full ingredient lists there, and we have more information in our documents online about that as well. With the 5R program, it's often talked about a 6R as well, which is helping with relaxation. So that's a huge thing that we know affects everybody. One of the reasons that we're mentioning it is because we know that stress induces endotoxemia. So one way of triggering low-grade inflammation in the gut is by increasing low-grade inflammation is by increasing basically leaky gut through activation of different components of the stress system. So although it's beneficial to meet the demands necessary during stress, increased intestinal barrier permeability also raises translocation of bacteria and their toxins across the intestinal lumen into blood circulation, and this means inflammation. They're in the wrong place. So in combination with modern lifestyle factors, we get increased stress to a degree that is no longer healthy, and that means an increase in the bacteria and bacterial toxin translocation to a level that is no longer healthy also. So we get this low-grade inflammatory state, which isn't being resolved and going back to normal because we're in the chronic stress stage, and then we get this chronic low-grade inflammation as well. So with the accordion concept, we really want to be looking at what we can do with relaxation and stress throughout this entire program, because it's going to really affect the ability of somebody to follow the program, but also their ability to then retain good gut health. So we have some tools. Like I say, Joe Gamble is going to come back in the next few webinars and talk a little bit more detail about any testing, but we do have a guide to stool testing that can be helpful, or you can call the office as well. So we just list by each of the products that we have that may be supportive, and also then a list of how we would potentially suggest these to be used with any of the analytes that have come up on the testing. So like I say, we're going to go through that, or you can give us a call if you've had that testing done for a client. So just really to summarise the gut program, we've got the remove phase with the Candex SIBO, looking at any kind of dysbiosis that might be there, like gentle dysbiosis. We're using similase to replace any lost enzyme function, and also just to relieve that pressure on the gut. We've got the reinoculation stage, so we're looking at Ultra Probiotics Plus, and we're using fermented foods as well. And then we're looking to repair, so we've got the glutagenics, and we do suggest using bone broths. Then we're looking at retaining that function once we've restored it by continuing to use the rest of the glutagenics, Nutrimonium and the bone broths. And that's something that you can then take and adapt to the individuals. So add-ons that we have for the gut transformation program are things like, with the imbalanced gut pH, we're looking at high stomach acid or low stomach acid. So what results did we get? So high stomach acid, we've got the Nutri, which is going to be fantastic for symptoms of dyspepsia. Then for low stomach acid, we've got the Metagest. And as we know, low stomach acid is probably a little bit more common, and we might be looking to add in something like Metagest on top of the similase for each of the larger meals. With bowel function, if we've got a rapid transit time or a slow transit time that we're looking to resolve, so somebody's come and that's their main problems, then you might want to add in something like the GI Sol, which is a Saccharomyces boulardii, fantastic for resolving rapid transit time, 2 capsules daily, or assess it on how the client is. So that might just be something that we want to add in at the beginning to help reduce the symptoms, and then the program itself will deal with some of those causes. Slow transit time, we've got Caricol, which is papaya puree. This is great for, not only does it support clearance, so we'd use 1 stick pack up to 3 times daily, or you can go up to about 6 a day for really stubborn constipation. But then once things start moving, we just go straight back down to half and half the dose until you're just on a maintenance of the 1 a day. Caricol is also really good for stimulating peristalsis as well, so that's one of the actions of how we believe it works. It's great for motility. And then if we suspected something like a yeast imbalance, then you might want to use that accordion effect and concentrate on something like Nutri. The same could be said here for a parasitic infection. You might want to, again, use the accordion and open up the program for a berberine and grapefruit seed protocol. And if there's inflammation, or which there often is, but if it's particularly problematic, then you may want to add in something like curcumin on a daily basis, just to aid and speed that reduction in the inflammation as we're going through the program. So here we just have a couple of examples of how you might use that accordion effect. So we've got our standard protocol, and at this point we have somebody with a dyspepsia, with the high stomach acid and reflux symptoms, and we're going through the program, but we're going to add in that NutriFlux at the first phase to try and see if we can get a reduction in symptoms, and then we continue through the rest of it. So this would be your weeks 1 to 2. We'd be adding in NutriFlux, then continuing with the program through the rest of it. So I've just popped in a few more bits of information about dyspepsia. Just so many people will be presenting with these types of symptoms, so it's one to look out for. Use the test, the home test for stomach acid. What we find is a lot of people are on medications, either self-prescribed as over the counter, or they may be taking something like a PPI as well. And then looking at the causes, it's not particularly known, but there's a lot of theories around stress, lifestyle, anxiety, the different foods and drinks that they're taking, maybe other medications that they're on, and the bacteria, the dysbiosis in the gut as well. So some dyspepsia may be either caused by SIBO or may lead to SIBO. So that's just something to watch out for as well. If you've got clients on PPIs, then what it's doing is it's just blocking the acid production, or it's reducing it down, and it's stopping that gateway symptom. So as soon as you've got either low stomach acid or you've got somebody taking a PPI, it's just reducing the situation further. They don't have the natural stomach acid barrier, and it can lead to infections. It can lead to changes in the pH further down in the digestive system, and you may even get things like H. pylori symptoms as well. So it's one to just look for if people are taking PPIs. The next few slides are just a bit of research on the ingredients that are in NutriFlux. So we have the licorice that's in there. We've got some great research on DGL licorice and H. pylori activity. And the one that we use is a patented DGL licorice called Gut Guard. And we've got some fantastic information just on Gut Guard for this purpose. This has also been shown to be really good for motility in terms of SIBO as well. So it's something that is looking so the licorice works on many different levels. So I've just got that information in there with the glycine, the marshmallow, and the chamomile, so we can go into that more. And then I've just popped one in here as well about parasitic poly, who is on the program, but she's going to have that. She's got a parasite, so maybe she's had a test done, and we've got blastocystis has shown up. So you can still continue to take the Candex SIBO, but we're going to extend that remove phase. So we're looking at using the berberine and grapefruit seed formula for the up to 3-month protocol. Or what you might want to do is initially we're going to extend and do the berberine and grapefruit seed for either 1 or 2 months before moving into the reinoculation repair phase. But it's essentially not a linear process. So the 5 Rs is always just a framework, whether you're using it as part of the program or outside the program. So we're going to overlap at some stage, some of these processes just to improve results and also to make it easier for the client as well. So I've popped in the information on berberine and grapefruit seed. This is one of our sort of just most effective formulas. We get such great results with blastocystis, and we've seen test results come back. The adapted dosage for parasites would be a 3-month process where you're reducing, you're not taking it every day, and this is to allow the egg and the cyst stage to develop. So we have some days without it to allow them to develop, and then we can kill them off. And so that's why in month 3 you're only taking it once a week. We're doing 2 to 4 capsules once a week, depending on how strong the infection was. So other protocols you might find useful in terms of opening up the accordion and changing the protocol to individualize it, depending on that differential diagnosis, are things like our IBS or 5R protocol. We've got a celiac disease protocol, and we've got a SIBO protocol as well. So we have other things, or you can just give us a call at the office if you're looking to change it out. And so what happens from now is you've all got your supplements, your packs. Hopefully over the weekend you've prepared and got all your foods lined up so you know what you're eating for the next few weeks. Hopefully you filled out your workbooks. Now what we do with these workbooks is we have a system, so you can use these with your clients as well, and it's in a similar fashion, but we will collate any results that we get back. So if you want to complete your workbook and then send it back to us, we'll collate the results and then produce a document and give that to everybody that actually shows what happened to all of the people who are on the program. So there's I think 80 of you all collectively. So if we get some really good results, we can make sure that you get those, and you've got a case study document then to be able to use in practice. So make sure you fill those workbooks out, because it's a great way of monitoring symptoms, and then we can get you started on the gut transformation program today. Pop onto Facebook to share and to learn, and we'll keep posting things in there. And then next week we'll have Jo presenting on some of the research around the gut and why we are doing what we're doing. So I'd just like to thank you for your time today, and go to any questions that have come in.
Brilliant. Thanks, Sarah. Okay, we've had quite a number of questions that have come through, so I'll go through them with you now. With regards to alcohol, is it necessary to abstain completely? So would drinking on an occasion once a fortnight have a detrimental effect on the progress made during the program? And if you are going to have a drink, are there certain drinks that are better than others?
Now, with alcohol, it's a really difficult one. I don't think it's a bit of a hard one. Every glass of alcohol will cause disruption to the gut lining, so it does cause damage. Even just one glass has been shown to cause some disruption. I think if you're going to have one night whilst you're doing the program, or if there's and it's only going to be moderate drinking, then it's real life. We need to look at real life and what people are actually going to do. So it's better if they don't, but if it's an occasion, like if it's a wedding or something like that, and you can plan around it, you can plan to make sure you're taking some glucogenics around it as well. The quercetin is very good for supporting the gut lining around alcohol intake. So it's something that you can do that. I think just make it a really real program, and make sure that if you're chatting to clients about it, you're talking about the situation, how they manage those situations moving forward, how they might reduce their intake at a family wedding, for example. But yeah, it's not ideal, but life happens whilst we're doing these things, doesn't it?
Yeah. Okay. And would there be any certain drinks that would be better than others, do you think, or?
Not particularly. I'm obviously staying away from things that are anything that's got high sugar or any of the sort of components that are not allowed on the program, and maybe just stick with the purer alcohol drinks. The ones that are a bit easier on the system, and no sugar.
Yeah, brilliant. How about the grapefruit seed extract in combination with medications, since normally grapefruit should be avoided for clients who take medications?
Yeah, so this is looking at the CYP enzymes that it can inhibit with the naringenin content. So we have information on the naringenin content that you need, and it's actually quite a large amount. So I think the amount in ours is low enough to be equivalent to about 10 mils of grapefruit seed juice.
Yeah.
And so it's a really low amount, whereas you'd be looking at generally it's like a glass of
about 250 ml, isn't it?
Yeah, that you need to actually start inhibiting. So I'd say it depends on the medication and how tightly controlled they are with that medication, but on the whole it's fine to take the grapefruit seed extract.
Yeah, okay. So in relation to the Candex, it looks like a nice product, but do we know that the combination will selectively target pathogens only and not commensal species as an antibiotic would? Could it have a negative effect on the microbiome? And I think the practitioner is using it without knowledge of a client's microbial dysbiotic status.
Yeah, so all of the ingredients that we're using have been shown to not really affect the commensal bacteria, so like oregano. They may have a very small effect, but on the whole, they are improving the gut bacteria by crowding out those bad ones. So on the whole, it's we do see that. I think the citrus seed extract might be the only one that's kind of across the board, but it's quite we're going to, the levels it's at aren't going to just wipe your gut like an antibiotic. And also that's why we've got the real focus on the reinoculation phase as well, is that often people coming into a gut program have very low levels of the lactobacillus and the bifidobacterium, and their microbiome is already very disrupted. So I think it's important to make sure that any program like this does include a really good reinoculation phase.
Yeah, and I guess it comes back to just really encouraging variety and, when it comes to the fruit and vegetable as well, getting that diversity in.
Yeah, keeping that diversity in, yeah.
Yeah, okay. Is it okay to eat cow's milk yogurt if it has live cultures in it?
Now, we were discussing this just recently in the office as well. If you've got something like a kefir, then the fermentation process has already helped to digest some of those proteins. So I'd say it depends on the level of avoidance that person needs. If it's just like a lactose intolerance or something like that, then a fermented kefir might be allowed. If it's a protein intolerance that they have, then it's possible that a kefir would still be okay. If you're not sure, then I would go with the non-dairy options. So you can get some like coconut milk and other milk options, and you can make your own with different milks. And then also you can get the water kefirs as well. So it's something to look out for. I'd just say just go with the plain varieties if you are going to use them, and monitor for that client how they feel when they introduce those foods.
Okay, so some of the dosages on the bottles are different for what is recommended in the program. Can you talk us through that, please? Just helpful to understand how to explain to clients if they question why we're recommending something different to what's already on the label.
Yes, so with, for example, the Candex SIBO, I think we just say one on the bottle. We quite often say just one or as directed, and then when we're looking at the amount that in practice we would recommend. It will vary and be often higher. So it will vary. Same with the Ultra Pro Bioplex. I think that will just say 1, but look, we're looking at an intensive sort of reinoculation phase, which is why we'll go to 2. So I think that will nearly always happen. We just have a responsibility to, if somebody just picks up that product and they start taking it themselves and it says that it can go up to 6 a day, then sometimes you get people self-diagnosing and going up to that level. So we will always leave it in your hands. So it'll probably nearly always say a lower amount on the bottle.
Yeah, okay. Can all the gut program supplements be used alongside usual vitamins and minerals and medicinal mushrooms like lion's mane and reishi?
It can, yes. What I would say is think about cleaning up the supplement regime that they're on, but is it something that can wait for 6 weeks or however long if you're using the accordion effect? How important is it to them? So it just to try and slim it down so they're not taking too many different things. But if it's something that they rely on daily, then absolutely you can keep it in there.
Okay. You might have already covered this one, but are there any medication interactions to be aware of with the program?
I would say always check. We have the safety checker online, and if you're not sure if it's a particularly complex case, you can give the office a call as well, and we'll happily talk it through with you. I think just anything where if it's very tightly controlled and it's something that they if it's antipsychotics or anything like that, or anything that's a blood thinner, then we'd start to get a bit nervous and we'd want to check those. But on the whole, we can usually find a solution or find a way of taking them at a different time of day, for example, so they're not affecting absorption. Okay. So it's usually fine, but always worth checking.
Yeah, definitely. Can you use NutriFlux with clients that are on PPIs?
You can, yes. Yeah.
Yeah. Okay. What about one night of eating trigger foods such as gluten or dairy? So really just the one night out of the 6 weeks, typically that there's a big event in February. I think this is a certain practitioner who's got something maybe coming up in February.
Yeah. It's always a difficult one. I guess it depends on the individual response. So what we're aiming for with the program is to get a really good improvement in symptoms. If you know that you don't react that strongly to gluten and dairy, then it may be that you just want to go for it, and you don't think it'll disrupt your program too much. For some people, that could be a real setback. So I think it's always difficult to know until you're at that stage and where you can trial it for yourself. So there'll be people moving forward from this who probably don't want to eat dairy or gluten on a long-term basis, but they'll know that when they introduce it back in, it'll affect them for days afterwards, weeks afterwards. So I think depending on what your personal experience is, I would say it's up to you. I would take enzymes, I would take all the supports, I'd make sure you've got your glutagenics there, and make sure you're taking your supplements around it. But yeah, I'd say assess it by individual cases. Again, it's the real world, and sometimes these things will crop up, and just coach your clients on that and manage their life around it, and make them aware of what might happen.
Yeah. Okay. If a client is taking Metatonic or Metazen, will these interrupt the program? Does the client need to stop for the duration of the program?
No, I'd say that if it's something that they're finding particularly useful, they can continue to take them. A gut program may be really useful in helping any kind of issues that they have around stress and that kind of thing anyway. So it's possible that it'll just reduce inflammation for them, and they might not find that they need them quite as strongly afterwards. But I'd say that they can continue to take them if they are feeling quite secure on them.
Yeah, okay. Water kefir seems to have a lot of sugar added to it. Is this okay for those who are dairy intolerant to use instead of milk kefir?
I think it's worth looking at if it's flavoured. A lot of the sugar is added at the beginning stage to then as food for the bacteria. Obviously, there's no milk sugars in water for them to feed on, so they need something to feed on. So it's just really how much is left or how much is added to the final product to make it palatable then. So I'd say it's come down to checking each label of each product.
Okay. Can you expand on the inclusion of vitamin D? Not too sure.
In the Ultra Pro Bioplex Plus, it's added in there. So just a gentle immune support. So just helping to support the immune, and it helps the way that the bacteria's, it just generally helps in the gut. So we often get vitamin D deficiency as well.
Mm-hmm. Can you use Similase and the Ultra Bioplex on kids?
You can, I think, with Similase, we say down to around age 4. Obviously, they won't be able to swallow the capsule generally, so you'd be opening it up and put it into water, and they could just have it just before a meal. It'd be probably half a capsule, I think, at 4 with a meal. Ultra Pro Bioplex, that's good right down to about 6 months old, but again, you're opening up the capsule and you'd be looking at just tiny amounts, so really like a sort of an 1/8 to a 1/16 of a capsule, maybe in the milk if they have it in a bottle, or in water if they have it in a cup of water at that age.
Okay. Where can I find the information regarding the FODMAP diet?
So we have this on the Facebook page. It's also something we can send out. We've got the FODMAP appendix. So that just complements the gut information pack that you've received.
Yep. Okay. I understand there is a transformation program on the website, but I couldn't find it. I think that's actually Facebook, so it's not on the website. It is the Facebook page, so you'll need to add Laura, Nutri Nutritionist, as a friend on Facebook, and then we can add you to the group. It's not actually on the website, it's Facebook. Okay, I think the final question, would enemas interrupt with the program if a client is doing coffee enemas for the Gerson cancer treatment?
I'd say it's on the individual. It's something that if they are using those, then it's up to them to sort of consider how that's going to affect. I think with the gut program, we're probably looking at restoring from the top up, so it's from the top down, whereas the enemas are working sort of further down. So it's possible they might want to take a break, or they might just, particularly on the reinoculation phases, it might disrupt that, I guess. But yeah, other than that, I'd say you're back to the individual and sort of seeing what they want to achieve with the enemas, and is that working with the goal of the gut program for them.
Okay, brilliant. Okay, well, I think that's all the questions. If anybody does have any additional questions, feel free to give us a call here in the office, or we will be on Facebook as well, so you can post them up there as well. So the next webinar in this series will be on Monday, 28th of January at the same time, 10:30 a.m. You will receive the login details this week. So thanks everyone for joining us, and we hope to see you next week. Thanks, Sarah.
Thanks. Bye.